Good morning, good afternoon, good evening from wherever you're watching us from. This is Dr. Lewis from the Health and Wellness Spot. Once again, we bring you a very interesting topic tonight that is basically cancer and chemotherapy. So we're going to talk about cancer in general. What is cancer? What are the causes of cancer? How do you prevent cancer? And definitely the chemotherapy. Now, I'm going to define that word chemotherapy so that you get to understand it, because some of the antimicrobial agents, like antibiotics, are also chemotherapeutic agents. So therefore, the word chemotherapy is sometimes misunderstood, but this is where we correct those things, and this is where we learn a lot about healthcare. So welcome aboard. Thank you so much for joining in for yet another live. We apologize for what happened on Monday, but I'm glad that already the response that is coming from you people is very interesting, and we appreciate that. We also know that we have loyal followers who actually understand the gospel that we're preaching and who are here. And I'm so excited to have you back here again, even with those hiccups. Now, we hope that today we will not have any hiccup, because we are bringing to you the very most important and most recent topic that has had a lot of research and a lot of studies that are basically yielding very minimal fruits and results. So we are wondering, why is it that there is a lot of money, a lot of research and resources that are being pumped in cancer and the treatment of cancer, even the new therapies that are coming up, yet cancer cases are still on the rise, just like diabetes and hypertension cases. So we are here to learn about cancer. We hope that if you are one of our students, as I just saw in the comment section, kindly take a notebook, take a pen, sit back, and enjoy this lesson today. So as we start, allow me to say hi to some individuals who are setting in or who are streaming into YouTube. We are only live on YouTube, so you can as well share the live so that people come in and learn something about cancer. Good. So again, as usual, kindly be kind to confirm if my sound is clear, so that when we start on a high note. Today we hope there will be very minimal, if not none, uh, interruptions and hiccups, because this one is going to be a tough one. Good. I don't know why they've decided to limit my monetization on these platforms. But again, hey, these people are so scared already. But yeah, it doesn't change the fact that we'll keep on spreading this information to all of you, regardless of what they do. Okay. So let me say hi to some individuals here and there. Safi, as always, good evening. I'm glad that you're here. Stephen Zelu, welcome aboard. Nyambura Rose, Wasike is in the building. Tapona Mugara, Mary Wamboi, Muga Joseph, Virginia Thomas, as usual. Thank you for coming through. Priska Anyangu, we welcome you aboard. Happy Valentine's to everyone. I hope you found love. Faith Odero, James Murithi, Catherine Mudhoni. Who else is here? Caroline Mwendwa, Samsung iPhone. Wow, Samsung iPhone. And Michael Bomet. All of you are here. Thank you so much for confirming that my sound is clear. Peter Makumi, Dorcas Waithera, Sophia Gabriel, Carol Jerry, John Mushiri, Silas Ayeko, and Sally Gishia. Warbit is also in the building. So thank you so much for joining in and streaming in. This is a very interesting one, and I hope you get to learn something from us as we also learn something from you. Now, I want you to remember that this coming week, we are coming to Nairobi. We are going to offer our consultation services in Nairobi, and the contact as usual is 0707 074722. That is our consultation number, and I'm putting it here and going to pin it so that if you have anybody who is suffering from chronic conditions, you can use that contact to get to us, book your appointment so that we get to slot you in for the consultation. It shall be interesting. It's always interesting. It's always informative. And you shall walk out of that consultation room a happy person and with a lot of benefits. So be there, call that contact and book those appointments. Also, if you are on my social media platforms, I appreciate you. If you are new here, kindly consider subscribing. This is the channel that will change your life for the better. Chege Victor, welcome aboard, and Thomas Mhlangu. So now, I was actually preparing for this live for quite some time. And as I was doing my studies here and there, I realized even in the medical syllabus, they have never defined cancer. But there is treatment. There is treatment. So I was wondering, how is it possible that we have never defined cancer adequately, but we have the treatment? So the question comes in, what are we treating? I don't know why these guys are doing this anyway, but yeah, we will continue. Just a minute. Good. So let us continue. Yeah, so I realized there has never been a complete definition of cancer. And I was wondering, why is it that we always have uh, definitions for all other conditions, even if they are the wrong definitions, but we hardly have a definition for cancer because, again, it has been so hard to define it because of how it comes to happen. However, most research and most textbooks and all this, they define cancer as an abnormally multiplying, this abnormal multiplication of cells, like cells are multiplying abnormally. And then we have to ask ourselves a question. How is it possible that your cells can start multiplying abnormally? Like, what happened for these cells to start multiplying abnormally? Is it because there's something that went wrong? Or is it because they are just cells that can invade us and start multiplying abnormally and then cause us harm? And the answer is this, that every day you have cells multiplying and cells getting into mutations, but your immune system handles them. Okay? You've heard of apoptosis. Apoptosis is basically programmed cell death. For example, your fingers. So this is an evidence of apoptosis, which tells you that these fingers, at some point, the hand was this way. But due to programmed cell death, there are cells that died in between to create you those fingers. And that is an adaptation of the body. So it happens naturally. Every day we have more than 1,000 and more than hundreds of thousands of mutations in your system. But the body handles that perfectly. However, there's something called the cell cycle. So, of course, as the cell is born, multiplies, and then mutations and all that, and then some of the cells die naturally. So that's a cell cycle, giving just like the same way we go through life. We are born, we live, and then we die. That's the same way cell cycle operates. So the cells are actually born, in quotes, and then they divide, and then they multiply, and then now at the end of the process they die naturally. So that's just normal. Okay. However, there are cells that can evade this cell cycle. They run away from this cell cycle. So they start from being born, and then when they start to multiply, they evade the cell cycle, and therefore signals that control the cell cycle are absent. That means that these cells will start multiplying abnormally. Some of them will cause harm to you. Some of them will be cleared by the immune system in form of the T cells. T cells are the immune system, are the cells from the immune system. So that happens naturally. Now we'll talk about that in details, but listen to this. There are four classification of causes of cancer. Number one on the list is age. As you age, your immune system goes down. And as you age, of course, There are organs that start to die slowly. The liver starts to age, your kidney starts to age, your brain, and all these aging processes can actually expose you to cancer. Also, as you age, sedentarism. Most of us eat very bad food, so over decades, because cancer takes more than 5 years, sometimes even decades for it to just manifest. Okay, but unfortunately nowadays we see a lot of cancers in children, and we will get to understand that. So age, as you age, your immunity goes down. Therefore, all other cells that are multiplying abnormally, including the cancer cells, can actually have a chance to proliferate. Number two is, of course, genetics, the hereditary. So how does genetics play a part here? It's a very small role, as I say. Genetics plays a very small role in this disease, in these conditions. But at least age and hereditary issues like genetics, we have no control over as much. However, the next two causes, or the next two classification of causes, are actually the ones that control aging and genes. So what are the next two causes? Number one is environmental factors, the chemicals, the smoking, the environmental factors like the herbicides, the lotions that we use, the cooking pans that we use, the non-sticky pans. So that is the environment. The drugs and medicines, the hormonal contraceptives, all that is classified under environment. And then now the lifestyle, sedentarism, consumption of simple and processed carbohydrates, foods that are rich in sugar, the fruits, the modern fruits, and all this. So now, at least for the lifestyle and for the environmental factors, we can limit the two. Once we limit the two, of course, we will control aging, because we can actually change your biological age. We cannot change your chronological age. We can't. But we can slow down aging process. That means we can easily reverse your biological age. Okay? And that is just amazing. That's why you fast to get your skin very intact. You fast to get your white hair just disappearing, and you're wondering, where did it go to? It's because you've been doing the right things and turning on switches for healthy living. So that is for the, so you can limit the environmental factors that actually cause or activate the genes. Now listen to this. On lifestyle, we have things that we call epigenetics. So if we have genes that are causing us cancer, or that mutation in the cells, so how do we regulate these genes? Genes are activated by something, and that activating substance is what we call the epigenetics. And about 60 to 80% of epigenetics is in diets. So if you modify the diets that you eat, then definitely you will modify how you activate or deactivate the genes that will actually expose you or cause you cancer and mutations, which basically tells you that for the environment and for the lifestyle, we have total control over. And when you have total control over those two, of course, aging will now start, the biological age will start being reversed. And then, of course, genes will be in check. So how amazing is that? So those four, aging, lifestyle, genes, and then environment, those are the four classification of causes. And as we discuss through, you'll get to appreciate every single bit of them. Okay? Now, after you have understood those classification of the causes, now you move deeper into it. So for example, we have about 3 or 4 things that actually are super involved in cancer and the mutations. What are these 3 things? Number one, something has to be initiated. Okay, you must initiate something, because if it doesn't exist, it cannot survive. So you must initiate the existence. And these are the initiators. This is where you write down on your notebook. So we have the initiators. Initiators. So what are the initiators of mutation? Remember, we are running away from the cell cycle. So what is causing us or our cells to run away from the cell cycle? Number one is the initiators. What are these initiators, of course? These are the initiators of mutation. They're the ones that begin the mutation processes. Now, you've heard me talk about you avoiding seed oils or the vegetable oils. You've heard me talking about you avoiding wheat products and processed carbohydrates. You've heard me telling you to avoid those processed spices. Okay. You've also heard me, last time we talked about the processed spice that actually has monosodium glutamate. We will mention that spice also today. Okay. So that somebody learns from you. And then we have things like those things that actually initiate mutations. They are things that we call carcinogens. So where are we getting carcinogens? From the environment, of course. Most times, or most people, are now addicts of cat. In Kenya, we call it miraa. And nowadays, people from Meru, people from Isiolo, people from Marsabit, people from Mandera and Wajir are so addicted to miraa. But the miraa industry is so big that they have to control pests and herbs, or pests and weeds. So how do they do it? They spray these plants with organophosphates, the chemicals. They also spray these plants with glyphosate. Glyphosate is classified as a carcinogen. Now, a carcinogen basically means an agent that actually activates or causes cancer. So glyphosate is part of that list. Now, we saw our government subsidizing the prices of fertilizer and then bringing in GMO. Those are some of the initiators of mutations. Okay. Again, we have tobacco smoking. If you're a smoker, this is the time to stop. By the way, tobacco smoking and even chewing tobacco. So most of you will think it's about the smoke. It's not. It's about the smoke and the nicotine. Then the presence of impurities in that tobacco. Okay. So the tobacco smoking, we have the glyphosates which are coming in. We have the heavy metals, and heavy metals are things like lead and mercury and arsenic. These are things that are present in your body lotions. These are things that are present in your skin lightening products. Women, your skin lightening product is full of mercury. So you're actually starting or initiating the process of mutation in your cells. And remember, mutations start from the mitochondria. Your mitochondria is the energy machinery of the cell. So mutations are initiated in the mitochondria. And the reason why we fast, one of the reasons why we fast is autophagy, so cell cleansing. And then after autophagy, we have mitophagy, which basically means cleaning the mitochondria. Remember, if your mitochondria is messed up, your whole system has a problem. And I know in biology, most of you used to ignore that. Most of you used to ignore that. Sally Gishe is saying, at Wasike, please pin the pay bill. Thank you so much for that. Yeah, I hope Wasike does that so that these lessons sink in as you people have support the channel. By the way, you can also support us by joining our memberships on YouTube. You can also support us by sending us your token on our till number, and it will be pinned there by Wasike or Abdulaziz. You can also support us by sharing our content and liking our videos and watching them actually, so that we get to reach a lot of people and we get to change lives from this channel. So thank you so much for being that kind, Sally Gishia. Thank you so much. So again, some microorganisms can initiate the process of mutation. So consistent use of antibiotics can actually expose you to more bad bacteria that can expose you to, can initiate the process of cancer and mutations. And then above all, radiation. On this radiation note, remember we're still talking about number one, the initiators. On this radiation note, you have heard the rumor that UV radiation will cause you cancer. I'm saying it's a rumor because if that was true, all Africans will be experiencing skin cancer. The rates of skin cancer in Africa are very minimal unless they produce the data. They are very minimal as compared to the West. So therefore, for them, their skin can actually have problems with exposure to UV radiation. But Africans, that is not true. So therefore, be proud to be an African if you are one. The radiation that can actually expose you to all these problems, and they don't want to talk about it, are the ionizing radiations, the X-rays, all those that you go through. When you're going through that X-ray, overexposure to those rays can actually cause you problems. Those CT scans, those MRIs that you do, they can actually, and I actually said one time that mammography, the procedure to diagnose breast cancer, is actually exposing our women to cancer. So you walk into a mammography room to screen your breasts for cancer, you have none, but you've gotten exposure to those rays, and then you end up coming back with breast cancer. So I don't understand. So some of these things you should avoid them. Simply fix what you have to do and move. Okay. So this is what is initiating these mutations. Now, on mutation, so we have mutation. The cell is now actually trying to go through mutations that will actually make it multiply abnormally. And these cells enjoy that. The cancer cells enjoy that. So on mutation, we have something that is called cellular repair. So remember this. Your body is very, very clever. So even though your cells are going through mutation, your body can still handle that because you have these mutations literally every day and your body handles them comfortably as long as your immunity is super boosted. So if your immunity is boosted, you will never have issues with all these mutations. So your body will handle it naturally. But the problem is if you have lowered your immunity through sedentarism, through bad foods, the inflammatory foods, and lack of fasting, not even training, not exercise, zero exercise. When you do that, what you're going to do is you're going to lower immunity. And once you lower immunity, and also men with aimless ejaculation and masturbation, once you lower immunity, what is going to happen is you're going to give these mutating cells a chance to proliferate. They will now start killing you slowly. So we have mutation, and then we have DNA and cellular repair. So that's a normal process. But this repair can lead to two directions. One direction is when you have that mutation, then you have this cellular repair, and then one, either that cell dies automatically because the immune system has realized this one is a criminal, kill him, dies. Or the mutation goes well and the cell rejuvenates, but goes back to normal. Perfect. On the normal side, that is done. On the abnormal side, one is death, the cell will die, the mutating cell will die, because it will be targeted by your immune system, which is called the T cells. So T cells are the killer cells. They destroy all the bad cells in your system. And that is part of your immunity. So they target them. Once you have a mutation and they realize they identify this as a mutation, they kill that cell. So that is okay. However, sometimes these cells are so many and they are so aggressive and they end up beating your immune system. They end up beating your T cells. So the T cells cannot fight them because they are overwhelmed. And how do you overwhelm them? By eating what you've been eating, of course. So when you overwhelm them, now you move to number two. Remember, number one was initiators. So you've initiated the mutation. You've gotten cells that are actually beating your immune system and overwhelming it. Now you go to number two, which is called the promoters. So if you're keen, you've realized we talked about initiators. Now we are talking about promoters as number two. So when you get the promoters, and promoters are basically what you've been eating. Now listen to the promoters. These promoters cause rapid cell growth. Because remember, after mutation, that can end there. The immune system can clear it. But now you've mutated the cells, and then these cells have gotten a chance to proliferate even more because you are giving them promoters. You're feeding them. When you feed them, you cause rapid mutation, rapid cell growth. That is the problem because we are actually feeding the disease. Now, the promoters are these. One, medications. Some antibiotics kill good bacteria. They give you a chance to get bad bacteria and you have problems. Number two, we have hormones and hormonal contraceptives. You have high estrogen in the system that is actually causing you mutations, and then you feed it with hormonal contraceptives that have estrogen. That causes estrogen dominance. That is a promoter. Diets are here. You're feeding the disease. Sugar is here. These cells love glucose because they are rapidly multiplying. And that is the fuel. So cells require fuel. And cells that are actually cancerous love glucose. They love sugar. So therefore, they prefer glycolysis over any other pathway of energy. So if you're consuming carbohydrates, if you're a constant consumer of simple and processed carbohydrates, this is the time to quit if you're a cancer patient or if you're intending to prevent cancer. Chemicals like the toothpaste, the commercial toothpastes, chemicals like the non-sticky pans that have Teflon, those soaps that you use to wash dishes, the liquid soaps. Have you ever read the ingredients? Those skin products that have mercury, that body lotion has all these chemicals. Do you ever read about, or do you ever read the ingredients? When you start reading those ingredients, now you start to realize you're actually promoting the mutation of these cells. And the last one, of course, is the progressors. So you start by initiating the process, and then you promote the process, and then now you promote progression of the disease. And what are the promoters of progressors? One is multiple mutations that are coming in as a result of the promoters that are causing cells to be very less orderly and more disorderly. And then they are causing spread. So for the progressors is spreading. Now, before I even talk about the progressors and the spreading, let me introduce you to something here. There are two types of cancer. One is the benign and two is the metastatic or the malignant. Write down. One is the benign, which is the localized, stays in one position. These are the tumors. They are they're actually defined, very well defined and differentiated. They are slow in spreading. They grow slowly. And that's why they need higher doses of chemotherapeutic agents. So they grow slowly. And let me give you a recap. I worked in Coast General Hospital under the Cancer Center. I learned a lot of things from this center. Shout out to Dr. Makori, who was actually my mentor when I was working in Mombasa Coast General Hospital. Shout out to you. We worked in the cancer center for about 3 to 6 months, and it was amazing because I've learned a lot from that. And when I start questioning the systems, it's because of the experience that I've had through these conditions. I realized when you're trying to mix the chemotherapeutic agents, the drugs for cancer, you are totally protected. You have a double gown, you have double gloves, you have a helmet and a shield, and then you have all these chambers that are used to make the chemotherapeutic. So it's like a glass all over here. So your hands are actually inside that chamber so that you don't get any exposure with that medicine. So when you're mixing them inside a chamber, and then you get them out after they are ready. So I kept asking myself this question: how is it possible that these drugs are going to get into somebody's body, into somebody's veins, when I am afraid of even mixing them? I was so afraid that this agent, when it comes to your contact with your skin, of course, it can expose you to cancer, because that is number one side effect of chemotherapeutic agents. The cancer drugs, they cause cancer. So I am so scared of mixing these drugs. I'm also scared of the contact with these medicines, but I still make them for somebody. That's when I started asking these questions. How is it possible that I'm the professional here? So I am so scared of this drug, but there's somebody who is sitting or sleeping or lying on that seat, waiting to receive this chemo for the next 2 hours. I also realized that when you take that chemo instantly, when it gets into the bloodstream, these people vomit instantly, and that's why they're given that vomiting drug that is called ondansetron. So they injected ondansetron, and then they injected the chemo. So they run concurrently, because the chemo actually activates the chemoreceptor trigger zones in the brain. Those are the centers that control vomiting. So these people will start vomiting instantly. And if you've ever had an experience with a cancer patient, or your family member has ever had cancer and you've seen or experienced that process, kindly tell us on the comment section. How was the experience? So I used to get afraid for them. I'm like, if only you knew how I'm mixing this drug with a lot of fear. But this drug is going to go into your veins, into your system. And you see them without hair. You see them with the very bad skin. You see them with oral ulcers. You see them malnutrition because their gut is messed up and therefore they don't absorb nutrients adequately. You see them losing weight. You see them coming back with anemia later on, bone marrow suppression. And then they end up dying of cancer, either the same cancer or the side effects of the drug that caused you cancer. So you take a drug for cancer and then you end up getting cancer as a side effect, and then you die from that. Or you die from bone marrow suppression. Chemotherapy is something that is, please take this seriously. When we talk about these things, don't take them lightly. This is a serious thing, okay? It's a serious thing. So be very cautious about it. Anyway, let's proceed. So the benign, we call them the benign. For example, some people think that an enlarged prostate is actually cancer. It's not. That's just an enlarged prostate because of several factors, and estrogen plays a very important role there. But cancers like tumors, the ones that you grow like a horn, you grow like a mass, those are benign. They are so defined. They are easy to get out because surgery can get them off. Drugs and radiation can shrink them and get them off, and you can survive that. They are so defined. So they have a coat, they're encapsulated. So they have a protein coat that makes them easy to destroy. But the malignant ones, the one that spread, when you say malignancy, we are meaning metastatic. So they spread. And listen to this carefully. Cancer spreads very fast through inflamed tissues. Cancer spreads very fast through inflamed tissues. And guess what? What are the inflammatory foods? What are the inflammatory foods that we talk about every day in this channel? What are those inflammatory foods? I'm waiting for the answer in the comment section. If you've been keen, what are the inflammatory foods? Which basically means if you've been consuming those foods, you're actually creating a room or a space for cancer to spread. So not only are you creating the cancer, the mutation, not only are you giving the initiators, if you remember, you're actually giving the cancer cells a pathway to spread faster and kill you. This is for my students who have been here for the longest period of time. What do you think are the inflammatory foods that we warn you against? The 3 pillars of bad diets or 3 pillars of bad health. So the spreading, the metastatic cancers are very dangerous. They're very harmful. They spread very fast. They cannot be controlled. Okay, so they don't have a capsule, so it's not easy for you to pick them out. And this is the reason why cancer chemotherapy is hard to actually help you or benefit you, because these metastatic cells are actually your own cells, only that they're multiplying abnormally. They have run away from the cell cycle. So if you've been here for long, you already know how to clear inflammation. Those people who have arthritis, those people who have autoimmune conditions, those people who have even asthma, you already know that you actually created room for quick spread of these conditions. Good. My students are very clear here. Sugar, wheat products, and seed oils or vegetable oils. Correct. Those are the 3 inflammatory foods. So imagine, by the time you're getting mutations in your 30s or in your 40s, you have had 3 decades of eating inflammatory foods. So how much inflammation is in your system? From the blood vessels, from the kidney, from the liver, from the brain. How much inflammation do you have that is going to create room and pathways for spreading of cancer? And guess what? Cancer survives on 2 foods, 2 energy sources. Number 1 is glucose. So cancer loves glucose. 80% of energy for cancer cells is glucose. That is your favorite carbohydrate. Number 2 is what we call the glutamine. Now realize this. Glutamine is an amino acid that is actually essential for your health. So you cannot avoid it. It's in vegetables, it's in all these foods that we mentioned. It's present. But there are 2 types of glutamine. They exist as glutamic acid, the D and the L-glutamic acid. We talked about it. If you didn't watch that, kindly watch the last live. So listen, that spice, that processed food, that protein shake, that milk formula, that pasta, that pizza, do you know what it has? It has something called MSG, monosodium glutamate. Underline the word glutamate. That is what we are talking about. Glutamate, and glutamate is an amino acid. However, in these processed foods, you don't have the naturally occurring glutamic acid. You have the processed and synthetic glutamic acid that is actually the best source of energy for cancer cells. So if you're using that spice, those cubes that are used, they fool your taste buds that this is not sukuma wiki, this is chicken. You're actually feeding cancer. If you're always lining for Terrific Tuesday for pizza, that is cancer. If you're using all these processed foods, if you're going ahead and giving your children milk formulas, you're exposing them to mutations. Add on that list GMO, add on that list soda, add on that list all these types of sugars and the fruits. How bad are we? How bad is our system? How bad is it inflamed? And how bad are we even encouraging the spread of cancer? And then we'll come back with placards. As somebody has died of cancer, we are all over singing, cancer will one day die. Cancer cannot die. You will die. You are the one who will die. Cancer will not die. So how do you prevent cancer? Number 1 on the list, drop the carcinogens. Stop feeding it. Drop the carcinogens. Go on organic foods if you can. Buy land and just start cultivating your foods. And we said at some point, this channel will inspire you to buy your own land from that payslip and start cultivating your own organic foods using manure from your own chicken and your own cattle or your own goats or rabbits. Use that rabbit urine as a pesticide. Very good pesticide. But you want to go and buy the best pesticide in the agrovet. You're wasting time. Go on organic foods. Avoid the chemicals that are actually environmental factors. Avoid hormonal contraceptives, the drugs. Women, birth control is in the hands of men. Let it stay so. Run away from birth control, the pills, the implants, the injections, the depots. Run away from them. Let the man wear a condom or retain his semen. Avoid GMO foods. Those of you who are addicts to Mira, drop that because they have glyphosate. They're going to cause you a problem. And some people who actually take Mira, you take Mira, which has glyphosate and all these herbicides, and then you go ahead and take it with soda and an energy drink. That is the worst combination. Just the same way somebody who has taken a cake, and today is Valentine's Day, so people are eating cakes. The worst combination is wheat and sugar. Angela Mudhoni, sugars in all forms, including fruits and honey, wheat products, seed oils, correct. So as you go and get addiction to that favorite food spot, that junction, why don't you just take time to cook your own foods? It's not hard. So the non-sticky pans, avoid them. They're just fun. They are fun. They are non-sticky. They are fun. They are very classy. But you're loading your system with Teflon. Mickey is saying today is cakes and chocolates day. Of course, people are taking this. And I wish you would eat the flowers too and get the glyphosate. Anyway, we celebrate all those people who are in love. Love is a very, very good thing and is a blessing to be in love. So if you find love, enjoy it. Avoid the skin lightening products. Women, stop lightening your skin. Enjoy the black skin. Being an African is the most beautiful thing you can ever wish for. Avoid smoking. Let alcohol go. All those are just chemicals that you're loading in your system. If you have to use household items, go for glass, go for stainless steel. If you have to use clothing, go for cotton, pure cotton, go for wool, and go for leather. Safi saying, I learned and enjoy cooking my organic food. It's awesome. There is nothing as awesome as fixing your taste buds by dropping these inflammatory foods and these spices and then cooking your own food. You start tasting food in their natural forms and it tastes so awesome and you will get to enjoy those foods. Some of you even sit in that restaurant. You've ordered food that is rich in seed oils, rich in sugar, rich in all these spices. You've sat there, you're not even enjoying the meal. You're on earphones, you're listening to music. You're literally all over. Then you take that soda and start belching. 2 hours down the line, you're still hungry again. You need to go back. And you think it's because that food was so awesome. That food is loaded with MSG. That chicken is coated with MSG. Go buy organic chicken and cook it. Enjoy it. Cook it with ghee. These are saturated. But actually, I'll talk about saturated fats as we finish this. So don't feed cancer. Drop the carbohydrates. By the way, carbohydrates are non-essential in our diets. We only do complex carbohydrates if we have attained our health goals. And the reason why we do that is because they do not spike insulin, they do not spike glucose. They give you a steady supply of glucose in your blood, and that's what we want. So drop sugar in all forms, including fruits and honey, including milk, because milk has lactose and milk sugar, and specifically, the pasteurized milk is the one that is most useless. 86 of us here. Kindly, if you're here, be kind to like our live so that it can get to reach more people. So we appreciate you liking the live as you're here. And as you're taking those notes, answer those questions that we ask. They are very simple questions that we preach here every other day. So be kind to like and share this live so somebody who needs it can get it. Don't be afraid to share this on your platforms, on your Facebook, your Instagram, your Telegram, your TikTok. By the way, you can join our Telegram also. Health and Wellness Sport, very important. Is milk good for kids? Call them children. Milk is good for children, yes. But let it be from the mother. I wonder why human beings change the species of milk. Anyway, let's continue. So then another factor that is actually related to sugar. Remember we said drop the carcinogens, and then 2, stop feeding the cancer, so drop the sugars. And number 3, since you drop sugars, you drop insulin resistance. Now listen to this. Insulin resistance has never been a problem. We've seen it being blamed for diabetes type 2. But insulin resistance is not a problem. Just the same way, when you get cold, your body will send you into shivering so that you produce heat. And when you get the heat, the body opens up your pores so that you sweat to lose the heat. So the body will always react to something that is being overboard by doing the opposite. This is the same thing that is happening here. Too much consumption of sugar and carbohydrates will cause your body to react in the opposite direction, which is insulin resistance. So it will tell the body will tell your insulin, we don't want you here. Therefore, in your blood, you will have a lot of glucose because insulin is the one that facilitates glucose flow into the cells. So you'll block insulin by resisting it. So it's a normal way of the body resisting insulin. Therefore, there will be a building up amount of insulin in your blood and also high glucose because the body is thinking you're actually starving because the glucose is not going into the cells. So the body keeps on giving you insulin. So therefore, the levels of insulin go up and the level of glucose go up. That is what we call type 2 diabetes. But you see, it's not about the insulin resistance. It's about you keep your constant spiking of insulin in blood. You keep on bringing in insulin because you eat all the time. So the body is now tired of that and then gives you a state of insulin resistance to protect itself. And then now we start blaming insulin resistance and start giving you drugs that will cause you more insulin problems. So reverse insulin resistance. And how do you reverse that? Because remember, insulin is actually a hormone that is what we call encourages growth, basically cell growth. So it encourages cell growth. So we call it a mitogenic hormone. Mitosis is cellular division. So it is a mitogenic hormone. So it encourages division of the cells. So if insulin is encouraging division of cells, that tells you high insulin in blood, which is insulin resistant, will actually activate cancer. And how do you lower the insulin? Drop the carbohydrates and stop eating all the time. Start fasting. Insulin also inhibits apoptosis. Therefore, if your insulin is so high, there will be no programmed cell death. So your immune system will fail to even identify the cells that are supposed to be destroyed. So insulin is very dangerous to you. High insulin levels are criminal. So drop them. And then how do you now change your diets? Simply go on a high-fat diet. Fats are very okay. Go on a low-carb and high-fat diet. Start fasting. When you fast, you produce ketone bodies. Ketone bodies are basically alternative sources of glucose. So cancer cells do not know how to utilize ketone bodies, but your body cells and your brain knows how to utilize ketone bodies. They love it, but cancer cells don't know how to utilize ketone bodies. So when you deny them glucose through not eating carbohydrates and then you fast, you're giving them ketone bodies that have anti-inflammatory activity, so therefore they kill inflammation, so they reduce your spread of cancer. And then number two, cancer cells don't know how to utilize ketone bodies, so they start dying because they don't have energy. Doc, how can you advise a patient on stage 4 colon cancer? Listen, book an appointment with us. We will give you all the information that you require, sir. Kefa, it will be very awesome if you refer these patients to us to just encourage them and change their lifestyle for good and see what will happen to them. In case you're forgetting the consultation number, we have it here. So there are things that we cannot discuss on a live, but we can do them face-to-face. That makes a lot of sense. So these are the times you book these people. 0707 07 47 22. Book that appointment and let's have that conversation. You'll actually learn more than you can learn on this live, because live we have to limit some form of information because of time. So autophagy cleans your cell, mitophagy cleans your mitochondria, and then fasting gives you ketone bodies that are anti-inflammatory, so they prevent spread of cancer, and they are also very bad sources of energy for the cancer cells. So the cancer cells will not survive on this one. So that is how you do it. Good. So let's talk something about chemotherapy. What is chemotherapy? Chemotherapy is basically you using an agent. So this is the definition of chemotherapy for the students. You're using an agent that targets invading cells or parasites or microorganisms, kills them, but causes very little harm to the host cells. The problem is cancer cells are basically your normal cells, but they are multiplying abnormally. So how can you kill them selectively? That's how the challenge comes in when you're using chemotherapeutic agents. That's how it happens. That's how it begins. So if you are treating cancer, there are about 4 mechanisms that are used to treat cancer. 1 is radiation, of course. 2 is the surgery. 3 is the immunotherapy, which we use immunoglobulins. And the 4th one is now chemotherapy, which we are using an agent that targets the cancer cells with little or no harm to the host cells. But of course, they have a lot of harm to the host cells. And these mechanisms do very well in tumors, which is the benign, but not the metastatic, the spreading one. Okay? So we have different classification of these anti-cancer drugs, but we cannot go into those classifications because if you are anywhere near in Marsabit or Moyale, you can attend the CME that is going to happen tomorrow at Moyale Sub-County Referral Hospital at 8 a.m. in the morning. We will discuss this also, and we'll make sure that you get the information that you require. So be there and attend so you can learn even more about this. Okay? So we cannot go into all this classification of these cancer drugs and how they change your life and their mode of action, but we can talk about something here that is actually the general toxicities of anti-cancer drugs. So what are the general toxicities of anti-cancer drugs? What are the poisonous effects or the side effects of these anti-cancer drugs? One of the things that you realize is that cancer drugs actually cause cancer. So one side effect is they cause cancer. So for these cases, prevention is better than cure. You cannot afford treating cancer and then getting cancer because you will die from cancer anyway. So remember that these drugs target rapidly multiplying cells. And the rapidly multiplying cells are those ones on the skin, those ones in the mouth. That's why when you burn yourself with tea, it heals so fast because the cells there are rapidly multiplying and they multiply so fast. The GIT, the gonads, okay, the brain cells. So these are things, and nerve cells. These are things that are multiplying, cells that are multiplying so fast. So number one, also the bone marrow. So on bone marrow, of course, the cancer agents kill the bone marrow. That's why you end up getting bone marrow suppression, and that's why these people always have anemia. Aplastic anemia is always common. So these people die from anemia also. Remember, also these drugs are cytotoxic, so they kill the kidneys and the liver. And therefore, anemia becomes a very serious problem in this. Number two is immunosuppression. So they suppress your immunity. When they suppress your immunity, of course, infections start to come in. Candida will come up, pneumonia will come up, diarrhea will come up, and dysentery. All these things, all these conditions, the cyclomegalovirus, the herpes zoster virus, all these opportunistic infections that are seen in HIV positive people start to come in. And then on the skin, of course, a very bad skin and also alopecia, which is just loss of hair. So they kill the hair follicles and you get loss of hair. And also contact dermatitis, not contact dermatitis, just dermatitis, inflamed skin. On the gonads, that's why they tell you to go ahead and have children before you start chemo. But that's on a lighter note though. So they kill your gonads, they inhibit ovulation, you will not ovulate, so they bring about permanent and temporary infertility. So you cannot afford this. Okay? You cannot afford this. You would rather prevent it rather than think of curing. So when you fail in prevention, of course, you'll end up getting this cure. And the side effects are very, very profound. They are instant. And some of you have even had a misdiagnosis of cancer, and you end up getting these chemotherapeutic agents, and you get now the cancer. So as much as there's a lot of research and a lot of resources being pumped in cancer therapy, not much is being done. Just know that. And then when you're pregnant, the fetus will suffer the consequences of this because they are teratogenic. So they can kill your fetus, they can cause mutations in the fetus, and that's a problem. Above all, they cause cancer. So they are carcinogens, they cause you leukemias. So you treat something else and then you end up getting blood cancer. And this can occur years after the chemotherapy. So you get the chemotherapy, now you get to heal, and then 5 years, 10 years down the line, you die of cancer. You think it's a recurrent cancer, and in real sense, it's a side effect of the chemotherapy. Then, of course, because of muscle wasting, because of cell wasting, there's a lot of uric acid being produced. So hyperuricemia is part of it, and kidney failure is there, and the liver failure is there also. So if you're wise, you already know prevention is better than cure for cancer. Prevention is better than cure. And if you have to take a point home, stop feeding cancer, stop taking sugars, stop taking the seed oils and inflammatory foods that actually activate the spread of cancer, and start fasting because fasting will help you heal inflammation, so no spreading cancer. It will help you get autophagy and mitophagy, clean your mitochondria. It will also help you clear mutations, and above all, it will provide energy sources for your cells and your brain cells that cancer cells don't know how to utilize. That is how you survive from this. Now, this is for early stages of cancer, maybe stage 1 and 2. But those people who have progressed to stage 4 cancer, it's very difficult for us to reverse that because it has spread to all other organs. So don't expect us to help you change your situation when you have stage 4 cancer. But if you're still healthy, in quotes, kindly start preventing this as early as possible. Now, allow me to make this advert again. 0707 0747 22. That is a contact that you should engage and book your appointment for this week that is coming up from 19th all the way to 29th. Book an appointment with that contact so that we can get to have this conversation with you in person in Nairobi. So if you are in Nairobi, use that contact to make your consultations. Kindly consider subscribing to our channel so that we can, anytime we have the brilliant health ideas, we get to share them with you. Okay, you'll be the first one to be notified. Also, consider taking up the challenge of being part of our members by joining the YouTube memberships. You can also join my Telegram channel. It's a rapidly growing channel, which basically gives you health tips every day. It's called Health and Wellness Sport on Telegram. So be part of that. You can also join my X, Lewis Muchile. You can join my Facebook, Lewis Muchile, and my Instagram is Dr. Lewis Muchile. On all platforms, I go by that name. You can join TikTok also, Health and Wellness Sport, and also Dr. Muchile on those two platforms, those two accounts on TikTok. So again, I hope you've learned something today. Thank you so much for being part of us. If there's anything you need me to clarify, be sure to use that contact. I'll be at your service. So thank you so much for joining in. I hope you've learned something about cancer tonight, and I hope you've learned about chemotherapy. So we'll see you again on Friday, God willing. Have a good night.